It's often said that a woman is at her strongest when she's pregnant, because it's not just the woman who is about to give birth to a new life. The woman also acquires a new dimension to her own life. But it's also during pregnancy that a woman can become susceptible to a host of diseases. Right from hypertension to a host of other disorders that can engulf an expecting mother, heart disorders during pregnancy are surely not to be ignored at any cost. So I spoke to Dr. Arun Cheriyan, specialist cardiologist from Aster Clinic, to understand how to ensure good health for both the mother and the baby. Thank you so much for being here, and today we're discussing a very important topic. And my first question is, what is the significance of heart diseases in relation to women's health, especially during pregnancy?
When we talk about that aspect, there are two things. We have to talk about two hearts. One is the mother, the other is the child, or in our terms we call it the fetus. So heart disease in the mother can be in again two ways. I'm sorry if I'm branching as per.
No, it's perfect. I think viewers would understand that very well.
Okay. So you talk about heart disease in a woman who is already having a risk factor or a heart disease. Then you talk about heart disease in women who are for the first time diagnosed with heart disease when they become pregnant. So in the first category, you have a bargaining time.
Correct.
You can prepare yourself for the event. In the other, it is thrown at you.
Yes.
So
at a very critical stage of their lives.
At a very critical stage. At a stage where it is supposed to be only bliss.
Yeah. And at a stage where you need to be very, very conservative with your treatments.
Yes.
Yeah.
Yes.
What are the complications that comes with the heart disease in a woman who's pregnant?
Majority of time, you can go ahead with pregnancy without much of a complication, including normal labor.
Okay.
There are certain conditions of the heart wherein pregnancy is contraindicated. I mean, you should not get pregnant. Like when the right-sided pressures are high, we call it pulmonary hypertension.
Okay.
So in that condition, or if the lady gets pregnant, what happens is that it is additional strain on her circulation on the right side of the heart. So we don't advise pregnancy in that
stage.
If by chance the woman gets pregnant, as a cardiologist, we advise termination. Usually what happens is, if somebody has got a hole in the heart, a shunt, they might be absolutely asymptomatic all along. And when they have breathlessness during pregnancy, and then a murmur is found, or the gynecologist is suspecting a cardiac abnormality, and the patient is referred, then we have to take the risk of proceeding with the pregnancy. We try to support by advising for a C-section or a cesarean section rather than normal delivery. Again, to protect, from our perspective, it is
protect the mother first.
Protect the mother first.
If anybody, any woman who's trying to get pregnant, what are the checkups that she should really get done to know that her heart is in the prime condition?
If you are healthy, if you have no symptoms of heart disease like breathlessness on exertion, rapid heartbeat, chest pain, or previously you are not diagnosed with any valvular or congenital heart disease, you should safely go ahead and enjoy motherhood.
In fact, in every segment we talk about are the lifestyle changes, and it's something that we have in our hands, we have the control over, and we must look at the way we are living, we are thinking and spending our lives every day.
One is try to reduce stress.
Yeah.
Big factor. Two, eat healthy.
Eat healthy.
Nutritional food. Rather than junk food,
yes.
Nutritional food.
It's not about the calories, it's about the quality.
It's about the quality, exactly put. So try to cut down on carbs, eat proteins,
yes.
you will be surprised to know that on an average, 1 kilogram of protein is or has to be deposited in the mother during the, because she is going to give those proteins to the baby. Third is exercise. Yes. Heart disease is not a contraindication for exercise during pregnancy. Actually, it is a misconception that if somebody has heart disease, you should not exert yourself. As cardiologists, we are happy to know that the patient is active. Because basically heart is a bag of muscle. So the more you train it, the more you exert it, the muscle becomes stronger. It's not that you have a right-sided pulmonary hypertension or your right-sided pressures are high and then you want to go for a marathon. No, that is not advisable.
But there are so many other ways to keep it healthy.
Yes. The general guidelines is that 45 minutes of cardiac exercise per day on at least 5 days a week. I tend to skip that 5 days a week part. So if I tell them that 45
5 days, they'll do it for 3 days.
They'll do it for 3 days.
Thank you so much, doctor. I think you explained it so well, and I'm sure my viewers really learnt a lot today from this segment. And I learned so much from all you doctors. So it's such a pleasure to have you on the show.
Pleasure's all mine.
Thank you.
Thank you.
A child gives birth to a mother, and so I always believe that a childbirth is not merely the birth of one individual, rather of two. And the best that one needs to do to ensure good health for both the newborns is to ensure a healthy heart.